Hi, friends. Welcome back to the Holistic Health Podcast. I have a feeling this is going to be a popular episode just by nature of the fact that this is something that is out there in the world. I know that I'm having a lot more conversations with clients about it at the moment, as I'm sure you are as well. And we have been asked to do some episodes on this. And I take that as a compliment in terms of I know that people are wanting to know what our opinion is, what do we think. And I actually feel like what I want to start with is saying that I'm not fundamentally for them or fundamentally against them. And I think when I'm thinking about sharing this episode and sharing this conversation with everybody, and even when I'm having it with my clients, I'm not thinking of it through the lens of what would I personally do or not do. I'm thinking about it in the sense of what is the information that is out there that we know that you can access? What don't we know? And I guess also if someone does decide to use them, how can we support them naturopathically rather than taking a complete black or white stance? And my personal perspective on that is that it's not to get out of having a polarizing opinion on something. I just genuinely don't. And I don't think it's my right or responsibility to make a decision about what someone puts in their body or doesn't put in their body, because essentially at the end of the day, you come to that decision based on your own personal values, on your own personal risks versus rewards and context. And so for me to feel like I've got some right to make that decision for everybody, as much as I'm sure that might be easier for some people to hear, I just think it's missing the point of being a responsible practitioner who isn't making decisions for people, but is trying to empower them to make a decision for themselves. And I actually think that's very important when you're going down the path of taking a medication that we know some things about and some things are unknown, whether it's GLP-1s or something else. But before we dive into some of the nitty-gritty of it, do you want to give any context from your perspective about GLP-1s and this conversation?
Yeah, I very much sit in the same camp as you. I think there does seem to be some sort of extra moral stigma around the fact that these drugs are for weight loss. That being said, in the naturopathic realm and people who, really want to be as natural as possible, there can be stigma attached to using medication for any goal. But if we were to put this back in its, I guess, context, it's the same as if you're looking at blood pressure medication or cholesterol medication or epilepsy medication or medication for anything. You want to make sure you're making an informed decision is the overarching theme here. But second of all, are there alternatives? What are the results? What are the, unintended side effects? What are the unknowns? Those are things you want to examine with any intervention, including herbal and naturopathic. And nothing really exists in isolation, although I think allopathic medicine, the way that it's set up, unfortunately, everything's kind of a bit disconnected from one another, but it also context matters, the human that's in considering it, their history, what else they're taking, what else they're dealing with. And so the purpose of this conversation, this part 1 and part 2, is just to really open up the chat about that. Part 2, I think we're going to cover off what we would do naturopathically to support GLP-1s. So that might be more popular than this episode. But I think for anyone who's maybe curious about them or is contemplating them or is concerned about them but is also interested, I think this would be just a nice place to start, don't you?
Yeah. And if anyone's a diehard natural wellness person and is angry at us for even putting a conversation out there like this, I just invite you to stop and think about the fact that it's not
about you or us.
or us. It's about the fact that people are going to make this decision anyway.
Yes.
And if we can add to that conversation and not create more distance between conventional medicine and natural medicine, then aren't we still stepping people in the right direction? And that's what I think anyway.
Yeah. We're removing what we would do for ourselves out of this picture.
Yeah. So I think maybe a helpful place to start is just explain what GLP-1s are, how they work, or just some of the different types at the moment. I will also say that this is an rapidly evolving field. So take note of the time that this is being released, so that you know that the information we're sharing is contextual to that time, knowing that things will change over time. And of course, as they do, and if this is a topic that ends up being of interest to everyone, we can circle back and do some updates on it. But it's just important to always name that when we're talking about something that's evolving. So just, check yourself before you
DM us or something, anything. Yeah.
I mean, you can, but that will be my response. So GLP-1, so glucagon-like peptide is what that actually is. It's a hormone that is actually naturally produced in our intestines, essentially, and also in the brainstem, actually. And it's released in response to food intake, and it's part of the body's what's called an incretin effect. So basically, it helps to increase insulin secretion, which helps to lower blood sugar. It suppresses glucagon, which prevents blood sugar from rising. It also slows gastric emptying, so it means that food is leaving the stomach more slowly, which can be a good and a bad thing as far as like the effect of this goes. And it also increases a feeling of like fullness or satiety. So GLP receptors, so the little doorways that are going to open to this, they are actually throughout the whole body. So they're influencing your gut, like your gastrointestinal system, essentially. But they're also influencing your pancreas, your cardiovascular system, brain, liver, muscles, kidneys, fat mass, fat tissue, and also your reproductive system as well. Now, when it comes to the GLP-1 medications, there's what we call like single GLP-1 agonists. So the receptor agonists, I should say. So those are things like semaglutide. So brand names that some people might be familiar with are like Ozempic or Wegovy. And then there are also a couple of others. So liraglutide and dulaglutide. So Saxenda, which was it's not being used quite as much in the Australian market anymore, but it's still out there, was an example of the liraglutide. And then there are ones that are becoming a little bit more popular to be used, which are actually what we call dual agonists. So they have a GLP-1, they work on GLP-1 receptors and what's called GIP receptors. So that would be Mounjaro, which is the one that is commonly used in Australia. And at the moment, at the time of recording and releasing this episode, the ones that are approved in Australia for weight loss in particular are Wegovy, Mounjaro, and Saxenda. And so that's just good to know, so that some of this, when you're hearing about them and you're learning about them or you're hearing conversations about it, you can kind of match up what's what. So I think I'm just going to pause there for a moment. I think maybe where we should go next is just understanding a little bit about what the research to date shows.
Yes. So as you mentioned, rightly so, this is a rapidly burgeoning area of like real-time data flooding in. I'm sure people have seen, some significant headlines where there've been deaths, and then, I'm sure everyone probably at this point knows someone who's, experienced significant weight loss on one of these medications, and A, could be loving life and thinks it's the bee's knees, or B, suffering from some of the side effects. And I think it's important to zoom out a little bit, and we will talk a bit more about this in the second episode, part 2, about supporting, like maintaining results. But one of the things that we need to be very mindful of is, regardless of the weight loss intervention, including these ones we don't sort of know, but probably going to be the same, is that rebound weight gain is very common. And that's because although medications can be really helpful, I mean, I did the HCG diet. I've done, I think, an episode on that. There are lots of interventions that, let's say, air quotes, work. But if you haven't addressed the underlying physiological, or psychological, or habitual lifestyle, nutritional variables that maybe got you in the place of being overweight in the first place, it's likely that you'll just revert back to those things and end up putting weight back on. So that is also true for these medications. And I think that's important to be mindful of if you're considering these, and if you are considering them or are using them, having a very intentional plan for them for support during and also after is important. But this, what the research shows is for Ozempic, Wegovy, so the semaglutide class, is the trials so far have been between 68 and 104 weeks, so up to 2 years. That's pretty significant in terms of following patients. The average weight loss at the full dose, which is 2.4 milligrams, was approximately 13 to 16% of body weight. Now, of course, that's relative to whatever your body weight was. And what that doesn't distinguish is how much of that was fat and how much of that was muscle. And that's one of the concerns. It's actually not just a concern, it's a legitimate actual risk and outcome, is loss of muscle mass, which of course is our number one metabolic driver. But anyway, I digress. It's a decent, it works. Okay. This is the long and the short of it. However, after a year after stopping treatment and other lifestyle interventions, participants regained around 2/3 of the lost weight. Now, is that better than gaining 100% of the weight back? Absolutely. Yes. There's obviously an adjustment with the set point, etc. But also you don't typically remain at the level that you come off the medication, which is, of course, the desired outcome, I'm sure. With Mounjaro, the weight loss trials haven't gone for quite so long, between 36 and 72 weeks, and the average weight loss at the full dose, which is 15 milligrams, was 20 to 26%, so a higher weight loss. Now, knowing that this is a dual agonist drug working on GLP-1 and GIP, that's not surprising information that it was a little bit more effective, or the weight loss was greater. And certainly when they're comparing them, we can see the difference is significant. In the case of Mounjaro, after a year of stopping treatment, there's a regain of around 14% body weight, which is certainly a lot less, but typically there is a maintenance dose that's used to stop that. And I do think we're going to see over the coming years different protocols designed around this. I think, the popularity of microdosing is really interesting. I think a tapering effect and certainly a lot of infrastructural support pre, during, and post-treatment, I think is going to achieve much better outcomes. And part of those plans also needs to be looking at what the typical side effects are / risks, and how can we potentially mitigate those. So the most blatant issue with it across the board is gastrointestinal problems. And there's a few reasons for that. Obviously, it slows down gastrointestinal motility. And we've seen a couple of cases of full-blown gastroparesis, like fecal impaction and death, because the gut just becomes paralyzed. Now, those are extreme and rare cases, but regardless, the movement of food through the gut is slowed down, which contributes to the feeling of being full and not needing so much food. But because of that, constipation can be a really big issue. Nausea and vomiting can be caused for other reasons around rapid weight loss, but are also part of that. We also see the converse, actually, with diarrhea. And so with these, they tend to be the things people need the most support with. And when we look at what's going on, there's plenty we can do to do that. These will most commonly occur in the first 16 to 20 weeks or 4 to 5 months, and typically are less common with microdosing or if the dose is titrated up. So I think it's a bit like anything. Like imagine going to from never running like me and then doing a marathon tomorrow. Like your body will just implode. Like the shift from where you are to where you want to go is so great. So, # common sense. Less common, but still things to be mindful of are gallbladder related issues. Rapid weight loss can absolutely trigger gallbladder issues no matter which method you choose. And of course, the faster you're losing weight, this risk does increase. That being said, it's pretty easy to support the gallbladder. Kidney injuries, less than 1% of users, but can be linked in some cases to gut issues, namely diarrhea that can result in dehydration. There are a few other things. I personally think the muscle loss is one thing that really scares the living daylights out of me. Because muscle mass is where we store our carbs. The more muscle you have, the more carbs you can eat without putting on body fat. And if you're losing muscle, you're losing carbohydrate storage, insulin sensitivity, but also that's our number one driver of metabolic rate. You're literally slowing your metabolism down when you lose it and aging yourself. It also has a flow-on effect to the bones. I recently came across a paper that showed a year on GLP-1s lost as much muscle mass as a decade.
Wow.
That is absolutely terrifying. And I don't want to say that's largely preventable because, the GI or the gastrointestinal issues can affect nutrient absorption. But this is where nutrient, supplementation could be really powerful to limit that. And of course, resistance exercise, things like that. There are a few other things to be mindful of. There's an increased association with ischemia affecting the eyes, although it is a low risk and more so in the diabetic population. Of course, they've got, capillary issues. And there are a few question marks around things that are being investigated but not yet proven. So, suicide, self-harm, neuropsychiatric events, depression, so changes in mood. What I will say though is because there's a dramatic decrease in micronutrient as well as macronutrient intake and also loss of muscle mass and also our body fats where we store toxins, I can really see how neurochemistry could shift and not in a good direction for people. And I'm sure there are certain people that are more at risk of those things than others. And of course, with rapid fat loss and gallbladder issues, we can also see pancreatitis. And that's another one that we just have to be really mindful of. So when you're looking at this, I know at the moment, especially because there's a lot of celebrities taking it and we're seeing, people in the public eye have previously been struggling with being overweight who've all of a sudden transformed their bodies. There's a lot of interest, understandable interest in this as a I wouldn't say it's an easy way out, but it is a leg up across, I guess, the shitty traditional methods and advice people tend to get in their GP's office. But I think it's really, no one reads the inserts on the packages of the medication that they're taking. Doctors don't have very long to explain things to you. And I think it's just really important we insert these things into the conversation because some of these are seriously significant.
Yeah. And again, it comes back to informed decision making.
Yes.
Because I think if you're not making an informed decision and something does go wrong, it hurts so much worse than if you actually are like, I feel like that. That's a personal opinion from me. But anyway, I think, that's all really good to know. And, there are going to be some nuances to that in terms of your own individual health picture might increase or decrease your risk of some of those things on an individual level. So that's where I really do think it's worth a proper discussion with maybe even getting two opinions, like medical or health opinions that are qualified to give you one before making an informed decision. The other thing I just want to bring into the conversation, because it's so relevant to the conversations I'm having in clinic, working with a lot of women who have endometriosis or even autoimmune conditions generally, but let's just stay on the thread of endo for the moment, because it's a question that a lot of my endo clients are asking me, because they're hearing about or they're reading about their friends or other people with endo microdosing or regular dosing GLP-1s, and finding that, you know, a lot of inflammation in their body is going down, or they're experiencing more easeful periods than they were previously. So I really think it's important to name that, knowing that that's going to be on the mind of some people who are listening as well. And what I would say is, again, at the time of recording this, there's no, to my knowledge, completed randomized control trials showing that GLP-1 medications are effective treatments for endo or endometriosis. But I can see that there's a lot of research interest in the possibility of that being a tool in the toolkit. And at the moment, though, a lot of that evidence is it's based on theory. It's based on observations of how these things are working, on the theory of understanding what's involved in endometriosis and matching that up with the what we know about the biological mechanisms of how these medications work and how that might impart some positive benefit from an endo perspective. So specifically, part of what that's referring to at the moment is that there are several studies that show that GLP-1 receptor agonists can actually reduce systemic inflammation, including some of these common inflammation markers that are, you know, present or risen in endo, like CRP, interleukin-6, TNF-alpha, which is probably unimportant for you to know, but just to say many inflammation markers in the body, and we are seeing that these medications are having an effect on that, and then by default having an effect clinical observation-wise on people's experience who are moving through inflammatory-based conditions like endometriosis. And I think that's where that is mainly coming from at the moment, but it's not like we have, oh yes, this amount of people with endometriosis have had this specific intervention and this is the outcome. Gosh, maybe by the time we even release this, because there's like a small maybe month delay from when we record to when we release sometimes, maybe there's something else out there, but it's just to let you know that's kind of where we're at. In terms of like, what do we know? Like, because I know that we've gone through a bunch of how it works. So what we know so far is we know that they reduce systemic inflammation. So that's going to have an impact in many conditions, in many areas of the body. We also know that GLP-1 levels might be altered in women with endometriosis, which suggests a potential mechanism or connection there as to why they're working. And the other thing that I would say is fair to bring into the conversation, if I'm putting on my hat of like, why would you use GLP-1s in endo, is that the weight loss that people get with GLP-1s, if that's the avenue that they choose, if someone is overweight and has endo, often losing weight and bringing yourself into a healthy weight range is going to have a positive impact on some of the drivers of endo. That's not to say that's the only way to get weight loss. It's just making the connection there of like appropriate weight loss if you are overweight and you have endometriosis is going to be of benefit. So that's another reason why there may be seen some benefits for people who are trying these medications for endo and seeing a positive benefit. The things we don't know yet, and I think this is important to name as well, because with science, there's always things we know, there's always things we don't know, and I think it's good to just acknowledge both sides of them, is we don't know whether or not GLP-1 medications have any effect on the actual endo lesions themselves. We don't know with certainty whether they reduce pelvic pain. Of course, people are experimenting with them, and I would say clinically, I have seen some people experience a reduction in their pelvic pain and period pain if they happen to have both of those. But that cohort for me is teeny tiny. So that's not to go with that and run with it, because I'm talking about probably 3 or 4 clients. And to be fair, I don't exactly have the client base that is leaning towards going straight to a GLP-1. So I'm never going to have a huge cohort of people to draw from. The other thing is we don't know whether or not GLP-1s are going to affect the progression of endometriosis. We also don't know whether or not like the benefits are due to weight loss or whether they're due to reduced inflammation or another mechanism. My personal opinion on that is it's probably both. And then also like clinically, what have I seen some of my clients who have endo and have chosen to go down the path of using GLP-1s, what have I heard them experience? I would say that a lot of them are reporting feeling less inflamed, feeling like they don't have as much of a quote unquote endo belly that if you have endo, you'll know, and also less just pelvic discomfort. And of course, by default, feeling like they've got a better quality of life. Some of them are still experiencing side effects, most of them gastrointestinal in terms of like some mild nausea. And I'm just speaking about my handful of small clients that are on it. But I'd say like as much as I will always be an advocate for natural medicine first, I think if you're feeling really quick to judge this decision that someone's making, even if it's someone in your life, and you running with the example of endo and period pain, it's as someone who has, experienced severe period pain and works with a lot of women with endo, putting up with that and living with that kind of significance of pain and the other ways it affects your life is really hard. And so it's really, I think I'd just encourage people before they make a judgment on someone who's chosen to use something that perhaps they wouldn't, just remember that you don't know what it's like to live in someone else's body or life and what feels worth it to them and not, and that it should be a nuanced conversation. Like I really think compassion on both sides is really important in the conversation is my personal opinion.
Yes. And I think, just looking at it more broadly, for its overarching uses, when someone goes over a certain threshold of inflammation, their insulin receptor sensitivity is compromised, their blood sugar balance gets compromised. And conversely, when you develop the constellation of issues that are umbrellaed under metabolic syndrome or syndrome X, that will drive inflammation. And you can get caught in this catch-22 situation, but that's very difficult to get off that merry-go-round. And whether it's for weight loss or any of the other applications this may be applied for, it can be the catalyst to bring someone back under the threshold where their physiology can then start to behave more normally. And I would never deny someone that. And, if you could achieve that naturally in 10 years and then do this with a medication in 6 months, why would you take 10 years to shift something and incur the tissue damage, for example? So I think, I think our audience are beautiful humans. I'd be very surprised if anyone amongst them would, be judgy McJudges about anyone using it. But I'm sure we've all witnessed people with very strong opinions about it. And the truth is no one knows what's best for you other than you. And sometimes you need to change your mind a few times till you find the right thing. But ultimately this conversation is around, here's like just, the high level view of what to be aware of. And in part 2, we're going to talk about how naturopathically, nutritionally, lifestyle wise you can actually, if you decide to go down this pathway, you can just stack the odds in your favor for supporting yourself, for, results during, maintaining results after, mitigating side effects, preventing side effects. And I'm actually really excited for that conversation too.
Yeah, me too. I think it's one of these areas, like often in health, where there's nuance and there just needs to be self-responsibility, gathering information, and then just making the choice that you feel most comfortable with as an individual, and finding practitioners that are going to support you in your choice rather than ones that are going to try and override your decision because it might not be what they would choose for themselves, because it's layered. And look, in a perfect world, I think you and I would both agree, we wish that people never got into a situation where they needed or wanted to consider something that is arguably like a quicker fix to a really painful situation that has the potential to cause harm or has side effects. But we're not living in that reality. We're living in a reality where there are a lot of people suffering. There are a lot of people who feel like they've tried everything, and maybe they have and maybe they haven't. And, when clients come to me and they say, is there anything else I can try? I'd be the first person to be like, here's the tools that are available to you from a natural medicine toolkit that we can try and implement. But in that same breath, if they felt like, and I felt like, well, I've given you all I can from a natural medicine perspective, and we've gotten you as far as we can, or you've reached your capacity for that change in your life, and your desire now is to move into trialing these, like, who am I to be like, no, you can't do that? Like, that's a cop-out. That's just rude.
It's so rude.
It's insensitive, and it's like, it's not, it's taking a decision that's not yours to make, and making it for someone, or making them feel shame for the fact that they're in that situation and feeling desperate and want to make a different choice. So
yes,
I think that's a different conversation versus like helping people understand the risks as an individual. And if someone's like really tempted by it and it's really obvious that it's they're not a really great candidate for it, I still wouldn't stop them, but I would push back a little bit to encourage them to see the other options. Or if I felt like they didn't have all the information, I'd help them access the information, but I still wouldn't stop them. So
totally. Yeah. The thing is too, like, there's a lot of factors, and we'll probably go into this in part 2, but like, you want to support someone to identify all of the things behind what's driving the problem. Leptin resistance is a really good one. Like, anyone over 35% body fat has high circulating triglycerides, and getting yourself back under that sensitivity threshold can be really hard. And I think whether it's GLP-1s or what was the one that made you shit fat? Remember the drug that was
I thought you meant me personally. I'm like, I don't remember doing that.
Xenical. Remember Xenical?
Oh, yes.
And then there was like Chidazan was used as like the nature's Xenical. Anyway, and I've done HCG, like, there's, and because I was kind of stuck in a leptin resistance loop because of mold and inflammation, but you can get really stuck. And prior to getting sick with mold, and this is the last thing I'll say on the subject before we wrap up, but when your body's really inflamed and really heavy, and as someone who'd never experienced living in a heavier body, and one who's then cardiovascular fitness went down the toilet, for me, I literally tried everything. And it was the thing that unlocked my ability to come down a level of inflammation and insulin resistance to then allow my body to start to recalibrate naturally. And natural medicines are used in the same way. Like, obviously we want the lowest risk, highest benefit route. And as, functional medicine practitioners, we're always looking for the root cause and correcting the underlying thing. But you can have your cake and eat it too, which is probably not a good analogy considering we're talking about weight loss. But it's okay to get some support. It's okay to introduce an intervention, whether it's this or something else, to help leapfrog you to the next stage where you've got a better handle on it. And I can personally attest to people I know personally and in clients that it has been unlocking a whole new world for them whereby they feel better in their body. They start moving more. They go to the gym. They go in public more. Their self-esteem rises. So they find it easy to make better choices. They're feeling more worthy of love-based choices. And I'm in full support of that. So yeah, all in all to say we're incredibly neutral about what you do and why you do it. All we give a shit about is that you make a fully informed decision and you feel comfortable getting the support you need along the way and are comfortable changing your choices along the way if that's what's required. But if this is something you're considering or you're already doing, we are going to do a part 2 to talk about everything in our naturopathic toolkit to kind of, dovetail around it to get the best possible outcome. So if you're interested, come and have a listen.
See you next time.
Bye.